Okay, Janet, we're ready.
Hi, everyone. It's 3:30 p.m. on Thursday, April 30th, 2020. Thank you for joining us. This is Janet Hill at the Rock Island County Health Department. As you can tell, we're trying a video Zoom today. We hope to be able to do this every day going forward. This is going to be a little bit of a test for us, so please be patient if there are any glitches. With us today are Nita Ludwig, the Administrator of the Rock Island County Health Department, Ed Rivers, the Director of the Scott County Health Department, Robert Erickson, the President and CEO of UnityPoint Health Trinity, and Doug Cropper, the President and CEO of Genesis Health System. Speakers have prepared statements and then we'll answer your questions to the best of their abilities. We ask that you direct your question to the person you are addressing in the chat box. And as always, Brooke Barnes of the Scott County Health Department will moderate our question and answer section. Nita, please start us off with Rock Island County numbers.
Sure. Today we are saddened to report that another member of our community has died from the coronavirus. We remain dedicated to working closely with our local partners, emergency management, throughout this pandemic. We urge the public to do their part to reduce the spread of this virus by observing the governor's stay-at-home order at this time. Today we are reporting 9 new cases of COVID-19 for a total of 435 cases total in Rock Island County. And this is now our 10th death in Rock Island County from COVID-19. 24 patients are currently still hospitalized. I just wanted to clarify a remark from yesterday's briefing that I said it was long-standing best practice from the Illinois Department of Public Health not to disclose the source of an outbreak. On Wednesday, the IDPH determined that talking about outbreaks at the meatpacking facilities was in the public's interest, and they gave the ability to the local health department administrator to share such information. Since we had been having questions for a few days about the Tyson plant, I felt that that was the accurate time to go ahead and share about the outbreak. As of this time, there are still 92 confirmed cases at the Tyson plant in Joslyn and 2 confirmed deaths from COVID-19 of Rock Island County residents. Thank you.
In Scott County today, 4 additional cases were reported for a total of 226. That's from 2,320 tests. So it's about 90% negative. Also, unfortunately, today it was announced there's been another death of a Scott County resident. We express our deepest sympathies to this family and the friends of this individual. And as COVID-19 continues to circulate, we hope we can work together as a community to do our best to protect those who are most vulnerable to the virus. Building on Nita's statements, in Iowa, we also act at the instruction of the Iowa Department of Public Health. IDPH is the custodian of the data for infectious disease. We as a local department can only report that information released by IDPH. And IDPH is usually quite conservative about the release of such information as the source of an outbreak, but has chosen to identify certain facilities in Iowa that have outbreaks of COVID-19. Illinois took a different position. In neither case did the local health departments have discretion regarding the release of that information.
Thank you very much, Ed and Nita. We appreciate your remarks opening up today. Today we are welcoming Robert Erickson, President and CEO of UnityPoint Health Trinity. And so we will go to Bob now for your opening remarks.
Thank you very much. It's good to be with you this afternoon. I want to start my remarks with a couple of words of gratitude, and I would like to thank the members of the media for your coverage of this over the last 6 weeks or so. Your coverage has been informative and educational and the right tone, which is more important than ever as we get through this as a community, and I just want to commend you for that. Secondly, I'd like to thank our community in general. I know there's a tremendous cost to social distancing, to stay in place, a personal cost, financial cost, business cost, but it seems to be working. which we're really pleased with. So since the last time we talked, we have seen an increase in COVID-19 patients, but it hasn't gotten to the point where it has overwhelmed our health system. So we've been able to take really good care of people, which is great. So we have seen us census peak out at about 50 hospitalized patients. Today we're sitting just under 40. And we've been pretty steady in that regard for about a week or so. So I don't know if that's a plateau or not, the way this works. We do worry about cluster outbreaks and what that does to health systems. So we continue to work with the community and the health departments, whether it's industrial or nursing homes, wherever it might be, that we can provide good partnership to make sure we mitigate the spread and we can take good care of people. In terms of our numbers, so we've tested this month about 2,500 residents, and I've seen just under 450 positives. Out of those, about 200 have come through the hospital, whether it's the ED or been hospitalized. And a lot of those people have recovered and done well. Unfortunately, some people, as you hear, have lost the battle. So mitigating that spread is just critically important. We also have quite a few going through our respiratory clinics and continue to do so this past week, where we see a lot of patients being tested. So the more access we have to tests, the more we can get a handle on what's really happening. So I want to thank the community for that. It's made a difference. Some of the models still show that we might hit our peak in a week or two, but there's so many variables at play that we just look at every day, how we're doing with our test results, how we're doing with our census, and then to make sure we got the proper equipment, staffing, and resources to take care of people, as well as the other people that come into the hospital for care. So with that, we don't know what our new normal is going to look like necessarily as things gradually start to reopen. We want people to be safe. We want people to continue to follow the guidelines to keep our community safe. But the good news is I think we're well prepared as we cautiously and safely start to shift into maybe a reopening and reactivating of certain things, that we do it safely and we're able to monitor real time, that we can handle any mini surges. I think as we go, it'll probably be sort of like an accordion where we keep things under control. Then we might see little surges and outbreaks, and we've just got to always be working on that together. So at UnityPoint, we're no different than other businesses, industries in certain ways. As we feel we've gotten a handle on this, we've been able to work hard to secure enough PPE, enough medications, enough bed capacity that we will gradually start looking at reactivating other healthcare services. And we'll do that very deliberately, purposefully, planned out very well. Prioritize things very well. We know there are members in our community that have been waiting patiently for surgeries that they really need. And so we've begun the planning of that. As we've got facilities on the Iowa side and Illinois side, there's a little bit different guidelines. So we're processing all that. We're working with our medical staff. And I would envision by May 11th, we should start seeing additional medical care and cases in our hospitals. And I want to assure the community, and I know Doug is absolutely committed, and it's been wonderful to work with Genesis throughout this, is they can be assured that they're going to be safe. We want people to get care. So it's a new day. We'll see what transpires over the next few weeks. This is a marathon. It's not a sprint. This is not going away, even though it's hopefully flattened. And this is something we're going to be dealing with as a community and healthcare systems for quite some time. But with that, it doesn't take us long to find inspiration. When we look at what's going on within our ICUs and we see people coming off the vents, when we look at our communities supporting us with donations, with supplies, with adhering to the stay-at-home principles because they've got our back. So as we recover over time and reactivate, we've got your back too. So I'm really happy to be here today and looking forward to questions.
Thank you very much, Robert, for that opening information. We do appreciate you being here and sharing that with us. Next, we have Doug Cropper, President and CEO of Genesis Health System. Please go ahead, Doug.
Well, I appreciate the opportunity to be involved today in the press conference, and we appreciate the opportunity to talk directly with the media and to be able to answer any questions. I would echo Bob's comments that this community has done a great job in taking the steps needed to flatten the curve. And I'll talk about this a little bit more, but we've seen many fewer patients than we anticipated potentially seeing, and that's been a very positive thing. Up until this point, our focus has been caring for COVID-19 patients and on developing our surge plans. And now we've been approved within Iowa and know that we'll be approved in Illinois to start to reopen services that have been closed, including closed physician office practices and beginning to do elective procedures and surgeries. We haven't seen the massive surge of patients that we prepared for or that other parts of the United States have seen, like New York. The highest daily census of COVID-19 patients that we've seen at Genesis so far was right around 50. And for about the last 10 days in a row, we have declined from that number, where to the last few days and almost this whole week, we have been hovering around 20 to 25. So we've seen a significant decrease. Now, I would note that even though our peak was 50, we planned for almost 10 times that many patients, or the ability to care for almost 10 times that many patients at Genesis Health System. And we did that in collaboration with UnityPoint and with Bob, as we talked about, and we've done a nice job of collaborating together. We are being extremely careful as we open up or begin to open up to ensure the safety of our patients and our staff. Opening up is, as a phase with a whole new set of challenges. There are guidelines, like Bob said, that aren't the same between the state of Iowa and the state of Illinois. And the opening date is different for elective surgeries, for instance, between the state of Iowa and the state of Illinois. And we must ensure that we take the right steps to protect our patients and staff. As much as I would like to say that we've put COVID-19 behind us, that is not the case. I think Bob's point and analogy is a good one. It'll be somewhat like an accordion, as we will not accelerate too fast into business recovery. We will begin to do that as soon as Monday, and we will look at ramping up, albeit we will ramp up slowly, and we will make adjustments as needed. It's not really that you have a green light and then a red light for elective cases. It's more that it's not really a light switch that gets turned on and off. It's more that we'll do these things gradually, and we'll be very careful, and we'll do them consistent with our vision and values, which involve safety, integrity, compassion, accountability, respect, and excellence. So, like I mentioned, we haven't seen the number of cases that we worried about or we thought that we have seen. Like Bob, the numbers are very similar, actually. We've tested just under 3,000 patients, and we've had a few hundred that have tested positive. We cared for, several hundred within our facilities, both patients under investigation and positive patients. Most of those patients have recovered, and it's been a great celebration for our staff and their families of patients have recovered, and we've had a few people die, but gratefully it's not been near the numbers that we've seen within other communities. I would mention just a couple of other things that may be of interest to the media. There's a lot of discussion about personal protective equipment. Our situation at Genesis with the personal protective equipment is very good. We're very aggressive in the acquisition of personal protective equipment. This is our highest priority, to be able to protect our patients, visitors, and our staff. We continue to be very conservative with that, but we're in quite good shape in relationship to that safety element, which is fundamental to being able to open up again. Lastly, I would just talk a little bit about our greatest challenge, and it would be interesting to hear Bob's comments about this, which is COVID-19 testing. We have internal testing capacity, which is around 100. But if we're going to be able to comply with all the guidelines, both in Iowa and Illinois, that require testing for procedures and surgeries, we'd have to have more of a capacity like 400 to 500 per week. And just for that ability, let alone our ability to be able to test inpatients. So this issue of testing continues to be a great challenge for healthcare providers. And the Test Iowa initiative, I think, will be helpful. It's going to test 500 per day within our community, and we understand that may open as soon as next week within Scott County. Testing remains a national issue, and again, we have the capacity to test 100 within our system, but we would probably need more like 300 capacity to be able to really do that justice. And we send out our additional tests to both the state labs in both Iowa and Illinois, as well as we send our tests to our Phoenix lab, which is a LabCorp partnership that we have. With that, I'd be happy to answer any questions that anyone has.
Thank you, Doug and Bob, for that insightful information to share with our community at this time. We will go ahead and go to the questions. I did want to make a note that this briefing is being recorded, and we do post this later on the Scott County Health Department website, and any partners are free to share that. But should you have missed any of the points in here, they will be available for you to see again once it is posted. So we will start off with some of the questions, and it looks like some of these may have been addressed somewhat in some of your talking points. Will allow you additional time to expand should you choose to. So for both hospital CEOs, and we will start with Bob for this one. Are you comfortable with PPE supplies? There's a couple questions here, so feel free to kind of choose which ones to start with. But how is staff managing? Are you dealing with burnout? And I think you already addressed the elective procedures piece, but how about regarding supplies and staff?
Sure. So as Doug mentioned, just to reiterate, our biggest challenge is the testing as we start to reactivate and want to test all patients coming in for procedure. Our PPE, we measure daily. We kind of have a red status, which should be alarming if we have less than a few days of supply on hand, yellow and green. We're green in all areas with the suppression of elective cases, and we've seen even kind of elective inpatient cases. We've been able to really preserve our PPE for the anticipated surge. With that, we've seen some freeing up of PPE throughout our system into places that might have a little bit more going on with COVID patients, which we have a little bit more than some of the other areas in our system. So right now, we're sitting in a good place. I'd say gowns continue to be probably the least available that we continue to monitor as we go, but everything else, we're in a pretty good status. In terms of how's our staff doing, I saw a question up about our furloughs. I mean, it's a very difficult time. You know, I think we talked last time as we've really prepared and tried to treat the surge of COVID patients, we've kind of turned off or suppressed a large part of our continuum of care, those elective outpatient surgeries and things like that, and admissions. And so with that, we've had to temporarily furlough staff, and probably about half of our FTEs were affected in some way with either reduced hours, reduced pay, or being furloughed. And so that creates obviously a lot of conflict, as on one end you're trying to ramp up to take care and deal with this, and on the other, the reality is we've got to be prepared to ramp back up from a financial perspective as well. With that, I'll say our staff has been incredibly positive, incredibly inspiring as they come in every day and do whatever they're asked. Sometimes we got people doing things they wouldn't traditionally do because they're not busy in a certain area. So it really feels like all hands on deck, not just within our organization, but really across the community and trying to collaborate. I think they find in real time a lot more inspiration than what they might see on some of the grim stories in other areas. We've got grim stories too, and bad outcomes of patients that are really sick, but we really celebrate, like Doug said, most people are getting better, and it's something to be celebrated. So they're doing well. They're concerned about reactivation as we go, and so that's got to be a very purposeful plan. The furloughs, a good thing, are temporary. So as we amp back up and reactivate our other services, we'll be calling people back. We've already actually started that process as we're looking at bringing surgeries back online.
Thank you. And Doug, would you like to address that as well regarding PPE, how staff are managing, and perhaps any additional details on the start of elective or non-COVID care?
Yeah, sure. I mentioned earlier that our PPE is in good shape, and there are some issues that we continue to work, but we have well over a month plus supply of everything. Bob noted. I would probably say that it's gowns. We've gone to a lot of reusable gowns in our highest using places, and N95 masks are probably nationally the other thing that's in shortage. The staff, Bob did a nice job of explaining this, but the staff at Genesis fall into 4 different groups is how I classify it. You've got those that are busy, and those are our ICU staff, our medical staff that are taking care of COVID-19 patients. You have those that are helping those that are busy. You have those that are doing kind of an emergency work. And then you have the places that aren't as busy, and many of those people have been reassigned to things that are related to surge planning or other duties. In some cases, that's helping visitors get processed and get screened as they come into our facilities. And then lastly, you have the group that's been furloughed. And I would probably say, we have 5,000 plus employees. I would say probably 4,000 out of the 5,000 have been touched in some way. It's a huge number. There's a large number of people whose hours have been reduced. There's people like myself that have taken voluntary reductions in pay. All of our executives took voluntary reductions in pay. I took a 30% voluntary reduction in pay temporarily. And so, there's probably not an individual, frankly, within Genesis that hasn't been touched in some way. But in some cases, it's just because they're taking care of COVID-19 patients and they've got very busy. But it's definitely not business as usual. Let me talk a little bit about, you asked about reopening. There's 2 different dates for elective surgery. However, our physician offices will start to open within Illinois and some of our other businesses that aren't governed under those elective surgery guidelines. For the most part, we will begin to open gradually next week, and you will see our physician offices open. We will do elective surgery cases. That's at our largest facility, which is GMC Davenport, and our outpatient services will start to open. It's not going to be a light switch, though. Again, like I explained, it's going to be a gradual opening. We'll probably, in the first week, start out at 25% of our normal business on elective cases. There's guidelines that have to be followed. Every single surgical patient has to comply with the guidelines at our hospitals, has to be tested. We have to know whether that patient is positive or negative within a 48-hour time frame within Iowa. And so we want to make sure that we can comply with all those guidelines as we get started this first week. And then over the course of May, we will ramp up to be certainly at a higher level of elective business within the month of May. But like Bob said, and I like that accordion analogy, we'll watch that very closely because we'll watch to see how many COVID patients we have and just how many electives we can do and how we'll balance that to not overwhelm the system. And, we've seen a significant drop. It's interesting, Bob's not seen the drop necessarily that we have within Genesis at UnityPoint, where we've seen that really go down, and hopefully we'll maintain that low level, and that will allow us to ramp up a little bit faster.
Thank you both. Our next question for Robert, would you please tell us about your respiratory clinics, maybe just a description of what that included as you were talking?
Sure. So we've kind of reduced the number of our ambulatory physician clinics where people can be referred for a COVID test. And basically anybody with respiratory symptoms are being referred to those clinics. Probably very similar to what Doug's done with his clinics and testing. And so instead of going to the hospital or the emergency room or to another physician clinic, we're trying to divert them all into one site. So we've got one in Bettendorf, one in Moline, one in Muscatine. And so the staff there then is trained, obviously, to safely test people and evaluate symptoms. And we continue to see, a fair amount of patients with respiratory illness going to those clinics. So, we know that it kind of gives us a real time of what it's like in the community. And so those have been going very well, that we can really focus on those. So I think yesterday, Dr. Olatude, who's our chief medical officer, is here. I think we had about 120 patients yesterday in our respiratory clinics, and 90 of them were tested. So not all of them come back positive, obviously, but it's a good way to really try to isolate and mitigate, to try to really have a focus on respiratory disease and how it could be COVID.
Thank you for that as well. For both health systems, how many employees have tested positive for COVID-19 and how many have recovered? We'll start with Doug on that one.
We have 13 employees that have tested. We had 12, and that was increased to another one today. We believe all but one has acquired COVID-19 in the community, and none have been significantly ill. So none have required hospitalization.
Yeah, very similar numbers. It's very small. I think for us it's 12, which represents like 0.3% of our employees that have been treating patients. And part of that is because I think we did get somewhat of a learnings from other communities on the appropriate use of PPE, and we're able to quickly educate and make sure that our staff is safe. So we feel very good about that. All recovered.
You know, I would just mention kind of what Bob did, that I compare notes with friends of mine across the country. I was talking with CEO of a healthcare system in New Jersey that's 3 times the size of Genesis. So you can get the idea. They had 500 they have 2,000. So it would have been more closer to 600 patients at our size, or excuse me, employees that had tested positive. So the fact that we have 13 versus, you know, their rate, it's amazingly low. And I attribute that to both our PPE as well as our employees being incredibly careful, doffing and donning protective equipment, as well as our environmental services staff. So to manage at that low of level is pretty incredible. And to think that we may have only had one individual employee who acquired the disease at Genesis is incredibly small, given the number of people we've taken care of.
There's one question at the bottom as a follow-up. Can you just explain how many employees UnityPoint does have, just for reference as you're talking about those numbers?
We have somewhere around in this region, I want to say about 4,000. When you take into account clinics and hospitals and all that, I believe that's about right. But we can get that specific count.
Great. The next question, I'm wondering about lost revenues to the hospital systems. Are there any hard number on those losses? So we can start with Robert on that question.
I don't want to talk about that question. So it's very interesting. Our revenues are down anywhere between 50 and 60%. And it's not kind of equal, I shouldn't say it, but you got to look at it as well, that the type of revenue that's down, at least in the financial component of healthcare, is typically the most profitable, because so much of healthcare has moved to the outpatient setting, where it's frankly, it's more cost effective to do outpatient surgeries than in a hospital. So we were doing pretty well through mid-March, and then obviously we made the right decision, as all healthcare systems did in the community, to really try to suppress non-COVID related services. So it's down 50% minimum. And with that had a fairly large impact on our bottom line, both in March and I know April as well. So it's significant. That being said, I know if I owned a small business and was listening to this, I'd say, welcome to the club. We know this has had economic impact on everybody, us included. So we'll recover as we go forward. We've been focused on taking great care of people and being safe. And we know it'll have a dramatic financial impact, but that's impacted basically every hospital healthcare system in the country at this point.
So our numbers we saw a revenue shortfall in March of 10 million. And essentially, we lost $10 million in the month of March. We expect our revenue shortfall in April to be great in excess of 20 million, and we will probably lose a number close to that. There is some federal support that will kick in the month of April because we did see some support from Centers for Medicare and Medicaid Services. We expect May to be a similar number. We'll see exactly what June holds. You know, we're ramping up quicker than I thought we would originally, given that June may be a little bit better depending on how much we end up ramping up in elective cases. Bob's right that it's, you know, hospital finance and healthcare finance is extremely complex. And there's a very few things that we do that we actually make money on. And those happen to be mostly elective. And many of those are surgical type procedures. And the rest is, you know, it's either a loss or a break-even type of a proposition. And reimbursement is very low within the state of Iowa and Illinois, whether it's commercial, Medicare, or Medicaid. So it's a tough place to run a healthcare business. I gave a number a couple weeks ago that's 70 million revenue shortfall. That's still probably pretty close to what we think it will be.
Thank you both. And we have some additional questions that I believe are in follow-up to the last time you gave us some updates. Are you still seeing the trend of lower numbers in the ER? And is there a worry that people who should be going to the ER are staying away out of COVID concerns? Perhaps, Doug, you could start with that question.
Those numbers again today, it's about 50% of what it normally is. And the challenge with that is, you know, that the people are out there that are sick. I mentioned last time we had a press conference that we had that weekend. 2 people show up our urgent care centers with active heart attacks that should have been at the emergency department rather than the urgent care center. We're still very concerned about this. We're still seeing only about 50% of what our normal volumes are pre-COVID-19. This is a national issue. Again, I compare notes with people all over the country. This is exactly what everybody else is seeing. People need to understand that we're open for business. We're open to take care of you. You will be very safe if you come into the emergency department. It's not going to be an issue. Was in a different state. My granddaughter got sick yesterday, went to the emergency department in Atlanta, extremely well cared for. I'm so glad she went in. They diagnosed what her issue was, and you know, she's home again today. So my own family members are going to the emergency department. It's a safe place. Don't worry about it.
Yeah, it's well said by Doug. The only thing I might add on as a different flavor to that is one group that we continue to be very worried about too is in our communities is some of those that are affected more disproportionately than others. And so, for instance, in our testing, almost 40% of our positive tests are community members of African American or Hispanic descent. And so we're trying extra hard as well beyond from a COVID educational perspective to make sure they also know what this is all about, and it's safe to get care, and we need them to get care because it's having a disproportionate effect on certain members of our community that we've got to reach out and really work together as a community to help them get the care that they need and have the resources they need to get care. So it's a very complicated kind of multifactorial world we live in right now in healthcare, and you've got all sorts of things going on that we learn about daily. So like Doug, I mean, our ER volumes are probably down at least 40%. We've been reaching out with telemedicine. For instance, the cardiologists are calling patients to kind of make sure to check how they're doing. So we're doing everything we can, but I completely agree. It's a safe place. Come in and get care. You got to make sure we're taking care of our communities.
We just had one point for clarification. I think this was to Robert as you were discussing the financial question. Does the 50% drop mean in real dollars?
Yeah, so we lost $7 million in March consolidated. So that was our revenue shortfall. And I'm sure April will be probably double that as we go. And the projections Doug had will probably be pretty close to as well. So for us, our consolidated financials for our regional system were about 600 million in net revenue over the course of the year. So 50% drop in that type of revenue is obviously very significant.
Thank you. That's the last question that we will be taking. Oh, sorry, we do have one follow-up, and then we will be ending the questions for now. This one is for Doug. Do you have stats for the number of African Americans and Hispanic positive tests at Genesis?
I don't have those off the top of my head. I do know that the demographics by age it's heavily weighted towards those that are 60 plus as far as the number of patients that have tested positive. We can follow up with you, but I don't have the demographic breakdown based on race.
Thank you. We will go to this last question that is for public health, and then that will be the last one, and then we will give both Doug and Robert a chance to give any final thoughts if they have that. So for Ed, we could have you start with this. Are there any other clusters or outbreaks in workplaces or care homes in either county?
Well, as I noted at the top of the call, any announcement of an outbreak in any facility of any kind in Scott County will be made by the Iowa Department of Public Health.
Nita, as well? Sure. So as I stated earlier, on the Illinois Department of Public Health website, they do have outbreaks in long-term care facilities listed by name, by county. So you can go there and see the numbers that are out there on our long-term care facilities for Rock Island County.
Thank you both. And we will give each of you from our health systems a chance for any final thoughts. Robert, would you like to share any before we conclude?
Sure. So one of my favorite sayings is a Chinese proverb that says, may you live in interesting times. And I can't think of a more interesting time in healthcare, but I've never been prouder to be in healthcare. And honestly, I've never been prouder to be part of a community where it's been a pleasure to work with Doug and to have health systems, health departments, municipalities, businesses, communities come together and work together. And I think there's a reason that we haven't seen the impact that could have happened in this community. And we're not out of the woods yet. We still could see surge without question, but that's because people here have really come together for the common good. I'm just thankful to be part of it, and we'll continue on this journey together, and we're here to help in any way.
And Doug, same thing, if you'd like to provide any concluding comments.
Yes, the first thing I'd like to say is thank you to the community for their patience and compliance with the restrictions that have been placed both in Iowa and Illinois. It's been very effective to flatten the curve, and we have not seen what other communities have seen, and I think the community gets the credit for that. Second, I would mention that we're here for you. We exist. Our mission is to care for you, and whether it's to care for COVID patients or to care for elective surgery patients or to care for emergencies, we're able to do all that. And frankly, we're very excited to be able to start to ramp up. We're going to make sure that we do that very carefully and very safely for the community, and in a calculated way that allows us to still care for anything that might happen with COVID-19 patients. The last thing I would mention is, like in the last press conference, I want to thank those who have stepped up within the community to help us, particularly with personal protective equipment. Sears Manufacturing has been nothing but incredible. They have redirected a tremendous amount of their energy to help. I know both UnityPoint and us, in whether it was sewing gowns or masks or whatever, they've been phenomenal. Han Industries has been phenomenal as well for us in helping us. And then we've had over 500 seamstresses in the community helping us sew fabric masks. So this community's been phenomenal, not only in responding to and complying with the guidelines, but also helping the health systems do what we do best, which is respond to these kind of emergencies. So thank you.
Thank you very much to everyone. Thank you, Ed and Nita, for your constant leadership on this on our calls. We appreciate that, and both to our health system partners for your willingness to share your planning efforts to help reassure our residents about our community's ability to respond to the spread of COVID-19 in our community. Again, we have been recording this, and we will be concluding it now, but we will be posting this onto the website. So please find it there should you need that. And again, thank you for bearing with us as we've been implementing the video portion of this. And thank you to our partners for being willing to be guinea pigs on this first effort with that. So again, we look forward to speaking with all of you again on these calls. Have a nice day, everyone.
Thank you. Take care.